Taking care of a newborn baby can be a challenging but rewarding experience. Here are some tips to help you take care of your new bundle of joy. Feeding. Newborns need to be fed frequently, usually every 2 to 3 hours. If you are breastfeeding, make sure to nurse on demand and seek help from a lactation consultant if needed. If you are formula feeding, follow the instructions on the label and prepare the formula according to the recommended guidelines. Diapering. Newborns will need to be changed frequently, so make sure you have plenty of diapers on hand. Check the diaper frequently and change it as soon as it is wet or soiled. Make sure to clean the diaper area thoroughly with wipes or a damp cloth. Sleeping. Newborns need a lot of sleep, usually between 14 to 17 hours a day. Make sure your baby is sleeping on their back in a safe and comfortable sleeping environment. Avoid loose bedding and soft objects that could be a suffocation hazard. Bathing. You only need to give your newborn a bath a few times a week. Use a mild soap and warm water, and be gentle when washing your baby's delicate skin. Make sure to dry your baby thoroughly and keep them warm after the bath. Bonding. Newborns need a lot of love and attention. Spend time holding, cuddling, and talking to your baby to help them feel secure and loved. Skincare. Newborns have delicate skin that is prone to dryness and irritation. Use a mild, fragrance-free baby soap and lotion to keep their skin soft and moisturized. Make sure to change your baby's clothes and diaper frequently to avoid irritation. Burping. During and after feedings, make sure to burp your baby to help release any gas that may have built up. Hold your baby against your chest and gently pat their back until they burp. Crying. It is normal for newborns to cry, as it is their way of communicating. Try to soothe your baby by holding them, rocking them, or singing to them. If you are having trouble soothing your baby, check to see if they are hungry, need a diaper change, or are too hot or cold. Safety. Always make sure your baby is in a safe environment. Avoid leaving them unattended on high surfaces, like a changing table or couch. Make sure to keep small objects and choking hazards out of reach. Health checkups. Make sure to schedule regular checkups with your pediatrician to monitor your baby's growth and development. Your pediatrician will also make sure your baby is up to date on vaccinations. Swaddling. Swaddling is a technique of wrapping a baby snugly in a blanket to help them feel secure and calm. Make sure to swaddle your baby correctly and avoid covering their face or overheating them. Tummy time. Tummy time is important for your baby's development and helps strengthen their neck and shoulder muscles. Start with a few minutes of tummy time each day and gradually increase the time as your baby gets stronger. Infant massage. Gentle massage can help soothe your baby and promote relaxation. Use a mild baby oil or lotion and massage your baby's arms, legs, back, and tummy in a gentle, circular motion. Baby wearing. Using a baby carrier or sling can help you keep your baby close while allowing you to have your hands free. Make sure to choose a carrier that is comfortable for you and provides good support for your baby's neck and spine. Playtime. Even newborns can benefit from playtime. Use toys with bright colors, different textures, and sounds to engage your baby's senses. Talk, sing, and make eye contact with your baby to help them develop their communication and social skills. Develop a routine. Establishing a routine can help your baby feel more secure and predictable. Create a consistent schedule for feeding, sleeping, and playtime. This can also help you plan your day and reduce stress. Be prepared. Make sure to have all the supplies you need within reach, such as diapers, wipes, and burp cloths. Keep a stock diaper bag with you when you're on the go. This can help you feel more organized and prepared for any situation. Take care of yourself. Taking care of a newborn can be exhausting, so it's important to take care of yourself too. Get plenty of rest, eat a healthy diet, and ask for help when you need it. Remember, a healthy and happy caregiver makes for a healthy and happy baby. Support network. Having a support network can help you feel less isolated and overwhelmed. Reach out to family and friends for help, join a parenting group, or consider hiring a postpartum doula to provide extra support. Stay positive. Taking care of a newborn can be challenging, but it's important to stay positive and focus on the joys of parenthood. Celebrate your baby's milestones, take plenty of pictures, and remember that this time will pass quickly. Breastfeeding. If you choose to breastfeed, it's important to establish a good latch and feeding routine. Make sure to nurse your baby frequently and on demand. This will help establish a good milk supply and ensure that your baby is getting enough nutrition. Formula feeding. If you choose to formula feed your baby, it's important to follow the instructions on the label and prepare the formula correctly. Make sure to burp your baby frequently during feedings to avoid gas and discomfort. Sleep safety. Place your baby on their back to sleep, on a firm and flat surface. Avoid using pillows, blankets, or soft objects in the crib. Make sure the room is at a comfortable temperature and dress your baby in appropriate clothing for the weather. Remember, taking care of a newborn can be overwhelming at times, so don't be afraid to ask for help or support. It's also important to take care of your own physical and emotional well-being so that you can be the best caregiver possible for your little one.